The latest JNC8 has really loosened up the blood pressure. So I think maybe for the first time in my career, they're actually recommending that we allow the blood pressure to be a little bit higher, even even wanting it to allow it to be like 145/95, because they're learning that perfusion of the brain is very important. So when you lower the blood pressure too much with medicines, you actually hinder perfusion, and the stroke risk actually goes up if you drive the pressure too low. I was kind of happy that they loosened that up, not saying that high blood pressure is good, but saying that through dietary and lifestyle changes, lower blood pressure is safe, and lowering it through medications is less safe. It used to be called permissive hypertension, and that used to come into play with stroke issues, that when someone was having a stroke, you would allow their blood pressure to be higher because you know that a brain that is suffering the stress of a stroke needs extra blood flow to help it to be as able to recover as much as possible. And now they've extended that permissive hypertension to an extent throughout all patients to a degree. Again, not that 145/95 is good, but you want to focus on the dietary and lifestyle changes that would bring it down, and less so on driving it down with medications, which have been shown to actually increase the stroke risk. And I always talk about avoiding pork and cheese products, because if you avoid pork and cheese products, you've improved your diet towards the perfect diet, probably 60% with that change alone. And as Americans learn those lessons, their risk of heart disease and strokes is just going to plummet.